Alright, so I'm going to do an oral care. So the first thing I'm going to do is check the patient's chart, gather the necessary items, and wash my hands before I enter the patient's room. Introduce myself, check the patient ID band. Of course, always wash my hands again. Put on the appropriate PPE. So I'm going to put on gloves, a mask if I feel like it, and feel like it's necessary, and also goggles. So what I'm going to go ahead and do before I do anything like oral care, suctioning anything with the patient, I always want to check the patient, listen to their lungs, check their cuff pressure, make sure it's inflated properly. So I'm going to make sure that's inflated properly, and you also want to check kind of where the endotracheal tube is placed. So after everything is done, get all the vital signs and everything, you're going to go ahead and get ready and get set up. So you're going to go ahead and get your canister here, and you're gonna connect it to your suction vac. And so with that, you're gonna always set the suction vacuum to -100 to -120 for an adult. So once that's all set up, you're gonna go ahead and do your first thing. So your first thing is gonna do is you're gonna set up your yanker suction. So you're just gonna take that out, and you're gonna connect it to your suction handle here, and you're going to go ahead and connect it to your suction, and you're going to make sure it works properly. Always check it and test it out and make sure it's all good. So then when you're ready, you move this back, turn it on, suction the inside of the cheeks towards the back of the mouth. Try not to touch anything that'll set off the gag reflex. Turn that off, put the protection sheath back on, remove it from your suction handle. Set it in an appropriate safe area so where it's not going to get contaminated. And then after that, so you would do your oral care steps every 2 hours so that way it prevents any infections or any sores in the patient's mouth. So the next one is a suction swab. So we're going to go ahead and get our suction swab out in the solution. So we're going to always open up the solution, and we're going to connect this to your suction handle. And so when you're ready, you don't have to have the suction handle on, so you're just going to dip it in there and make sure you don't have too excess where it's dripping. So you're just going to make sure you get around the sides of the mouth, around the gums, the tongue, and the roof of the mouth. Make sure that's nice and clean. And if you have any excess, then you can turn on your suction, and you can suction any of that excess solution that may be left behind. And then if you have any excess after doing that suction, you can always do your yanker, and you can go ahead and suction out again. So after you do a suction swab solution, you always want to apply moisturizer onto the patient, so that way it helps also to prevent them from having sores. So then you're going to put the moisturizer on here, just kind of like toothpaste on a toothbrush. So then you put it on there, and you're going to use this to spread it evenly around your swab, the applicator swab. What you're going to do is do the side of the mouth, around everything, around the gums. You're going to always do the lips also. So a lot of times the endotracheal tube will have a handle. So what you do is do one side, and then you can move it over to the other side. That way you can get both sides equally cleaned and also moisturized. So you'd always dispose of everything, those you would always dispose of. So then after 2 hours, then you come back, and then you do the next one, which is a toothbrush cleaning. So you go ahead and get out your anti-plaque solution, and then you grab out your toothbrush. So with your toothbrush, you connect it to your suction handle. So you're going to put it on your suction handle, and you're going to dip it into your solution. And so what you're going to do is go ahead and brush our teeth like what you would brush yours. So you're going to do it in a nice circular motion. But don't do it very hard, so that way you don't cause any irritation on the gums or anything like that. So you'd always move your endotracheal tube over to the other side. Always make sure you get back of the teeth and everything. So when you're done, you'd take this off and dispose of it, and dispose of the solution. Then you get your applicator swab, and you take another, moisturizer, place it on there, spread it around evenly. Get the sides of the mouth, make sure all the mouth is nice and moisturized, and also get the lips every time. And then you dispose of that. All right, then I'd come back after 2 hours, and then the next one I would do is the suction catheter. So with this, you take your suction catheter, try not to touch it on the bed or anything like that, so that way you keep it kind of as sterile as you can. So then you're going to attach it to your suction handle here, and then you're gonna turn it on, make sure it suctions, and you can always test it if you want with sterile water, that way that you know it's working properly. So you're gonna go ahead and suction around the mouth, always clean around the endotracheal tube, make sure there's nothing excess building on the endotracheal tube. Get the back of the mouth, make sure there's nothing getting caught back above the cuff, and always get the sides of the cheek. And when you're done, you can take this off and dispose of it. Then when you're done, you would always dispose that, and you can place this back in the safe area. Once you're all finished, always make sure everything is disposed of, and you're gonna go ahead and reassess the patient. Listen to the patient's lung sound, make sure your endotracheal tube is placed in the proper area, and always make sure your cuff is inflated. And you can also listen to make sure you don't hear any of that extra gurgling sounds or anything like that. And then once you're ready, remove any PPE, wash your hands, and then go turn on the patient's chart.